Hello and welcome to the Health Tech Glow Up. I'm Nathan C., and today I'm talking with PJ of Avo MD. PJ, thank you so much for joining me.
Great. I'm PJ, one of co-founders and chairman and chief of product AI at ISD there. I'm working on for a company called Avo MD. This is the AI platform, clinical co-pilots for clinicians.
Mm-hmm.
And then I have an international background from Korea around 10 years ago. I also a clinician from my side, a doctor, Harvard medical faculty, but I decided to dedicate myself to the intersection between AI and medicine. So inside of our future, we are trying to build a platform where all of the key to solve problems. I mean, there are so many problems in the world, we want to solve all, but in a scalable way so that we are expanding and scaling, like building solutions in label like fashion in our platform.
I'm always very interested about people's origin story, about why they begin an entrepreneurial journey. Being a clinician is a full day job, right? So I'm curious, what sparked the inspiration to start working in AI and technology in addition to your other practice?
Let's say I never really seen myself as an entrepreneur. I mean, I never had a dream of like, okay, I want to build a company, CEO, whatever. I just want a doctor. I be a doctor, and then during it, so I was an intern. I came to the residency, and then of course I was not the smartest doctor during the residency, but there's a language barrier. The first day I was barely able to speak English. What I remember is that like my senior was asking me to, hey, this patient is dying, contact them family and then let them know, and then I was like, oh my God, like well, of course I messed everything.
Life happens, yeah.
So that given my background on engineering, AI research, and UI UX, one of the things I was really focused on was like, okay, building softwares on my own. Let's keep some kind of like relationship between app and human doctor, and then make my kind of imperfect doctor perfect. That was my dream. It was just a hobby. That was doing since my residency in Belarus. I ended up with like 50 different apps, and then some of them are featured in the newspaper and everything. So that it led me to Colombia, machine learning research over there. Also, I was very interested in UI UX, and then eventually I noticed, oh my God, I cannot. What's the point of building 50 different apps? Those kinds of things actually still happening. At that time, I thought that I'm able to build a platform where there are some common, like shared component between all of these applications so that we can scale, solving more problems best and faster. And then I had no idea what companies, but my friends and my coworkers, and then my future co-founders that coming in told me that, hey, you should build a company. What does that even mean? Like I started Googling and I thought that, okay, this might be the only way. I'm so excited about those pros and cons. Way to make it work is to make it a business making money so that this is self-sustaining. This is how I started. So that's all the different from his stories from others because I know that many people have big dream of like, I want to make money or make a big business change the world. Yeah. I went all the different ways. Yeah.
I love that, like the entrepreneurial spirit and the like, here's a problem that I'm experiencing in my day job. I'm just going to go fix it. You accidentally fix 50 different problems. Yeah. And then people are like, hey, like, this is really like what an entrepreneur does. You should probably start a company. I love that you were the last one to know that you had this entrepreneurial mindset. It was just like part of how you're solving problems. Can we dive a little bit into the solution with Avo MD and with the product that you're working on now? And help me understand, the health tech audience, the tech glow up audience doesn't necessarily know a ton about health technologies. So if you can kind of introduce your product and
put it this way. I mean, there are many different sectors in healthcare, like patient side and then the payer and everything. I'm always focused on clinical care, improving clinical care, and then any revenue influence inefficiency issues in clinical care where providers, physicians, and nurses involved. So focusing on that area, what we do is that there are so many problems and then with a complicated workflow. Let's say I'm automating a patient. It's like, I'm assuming there are so many AI technologies over there so that like but you still doing all the like EHL, like Epic, like chart review, clicking everywhere. Epic has some features, so you summarize a portion of it. Okay, now some of clinical care involve patients doctor encounter, so that you might use the AI scribe system, make a record to enhance your to the documentation. Now you need to make some decision. Your clinical knowledge is imperfect, and then you need to go to like up to date, probably on Wikipedia, and then everything. And there's filling solutions, so that all of the solutions are scattered and high focus in a niche. Like we call them like one trick pony for one solution. And then I know that we have 1,000 different problems, and then this is not really working in a way we want to change the world, how the healthcare and behave within 5 years, 4 years. But
It's like death by 1,000 clicks, right?
so that we decide to build a platform. Okay, we know you said that that's by 1,000 clicks. That's an example of really, really bad user experience.
Yeah.
But we noticed that there are some common shareable components between this workflow. For instance, if you clicks, I'm looking for your like advice on it, so that we can come up with a better solutions that is more deeper AI human doctor relationship. Those components can be shared between things, and then you can build this kind of solution really in a test. Just mix and match this kind of level block, so that there are solving many different clinical problems, like better admission, better discharge, better like patient encounter, outpatient, inpatient, or more. Oh,
It's always exciting when you have a new tool and you can be seeing all the different layers where you can make an impact. The name of the show is the Health Tech Glow Up. The glow up is a notable transformation or like a rebirth. Let's start general with the health technology or health industry as a whole. Do you have a goal, or is there a glow up you want to see in health technology, like in the next 6 months? What are your big goals or challenges to the industry?
if you say 6 year, I have a lot more to talk. But you say 6 months,
Yeah.
that I'd like to say two different things. One is in clinical care, like everybody's talking about is now AI scribe. I want to see something, because I really love AI scribe, because this is like first AI solution people ended up with loving it. Most of the previous solutions are mostly driven by healthcare administrators that kind of construct them in enforce such actions. You should do it. You should do it. Click, or like pop ups. Don't ignore it. Kind of in a way built with a distrusting clinicians that they should follow, so that the people don't like it, not all of it, adopt it, so it doesn't change the world. Probably one of a few other solutions is actually working, but I think it's still covering only a very small portion of the care, because surprisingly, there are a lot of clinical care area doctor-patient encounter is not really happening. For instance, if you're discharging patient as a hospitalist, you're talking to patient for 5 minutes, and then the next 2 hours is there. It's not just documentation. You just need to collect all the dots within guidelines, like hospital protocols, and what's the best things to do. We send out prescription and then make a right documentation and bill it, and then even deciding auto-based probably just like evidence, is the patient even ready for discharge? Like kind of very complex decision making is there, and AI scribe cannot really tell you anything because there's no recording. AI scribe would like kind of make an assumption that what useful during the conversation is the ground truth. But here, doctors trying to make a ground truth right thing. So how can we help those kind of area is one thing. Second part is I want to see happening more beyond EHR companies, such as like incumbent EHR like Happy. Because like when we are doing this kind of thing, everybody's asking us, what if Epic is doing EBC? Yeah. That's a really good question. Every single investors ask us, but I think it's somewhat misleading questions, because Epic, they can do it because they own initial user interface layer. They have the order with technical like stack and then pretty much operating system. But on the same way, like Microsoft build the Windows. Okay? Like let's say somebody built an amazing game like Roblox. What are you asking people that build those Roblox? Like, okay, they're making $1 billion business. What if and Microsoft is taking over Roblox and building on their own Roblox? Like what if Microsoft building EHL? I mean, they clearly have advantage. What if they have like default application Roblox and EHL? Doesn't make sense, because first, it's not gonna be happening that any single company can do covering every single area in the world. It's impossible because that's why startup even exist.
Yep.
Yeah. People have a different culture, different style of teams. Having money doesn't really guarantee anything. That's why startup even exist. Secondly, they shouldn't do that, actually. Like, same way, not necessarily Apple, iOS, they don't need to build every single app.
Okay. Needs to be a platform level tool.
Yeah.
And sometimes other tools building on can actually make a
Right.
more robust system. Sure.
If that's happening, then like iOS, Apple will be almost like Soviet Union, like trying to like govern every single aspect. It's not gonna be working. It's gonna be inefficient. That's why they don't do it. It's clever. And then even Apple and many edge company, as I talking to, they don't see them as they're doing everything. They know they want to retain some core elements as a fundamental experience of EHL, but other areas they don't want to touch it. Even they want to touch it and see that very often unsuccessful. Yeah.
You make a very interesting point about where a platform is interested and invested versus where a more focused solution can provide deeper value. Oftentimes, there's this assumption that platform play is the best way to go because it serves so many needs. But if you're serving so many needs, you're maybe not serving them as deeply with as many insights, with like the cultural, workforce-specific nuance that a targeted solution can provide. And I really love it.
Yeah.
So let's move on and actually turn toward your company specifically. What's the glow up that you're working on for Avo MD? What are your big goals for the next 6 months?
Next 6 months, not 6 years, right?
Yeah. I mean, you can give a 6-year answer as well. Like
taking over their medicine.
we'll just podcast a few more times on the way.
Right. So I told you that we are a platform which allow us to build like any types of the pilots, but whether it's admission or it may scribe and anything scalable way, so that the clinical speaking, I want to take over every single workflow in medicine, which is not practical. We cannot do that now.
Not yet.
Then we are hyper focusing on a few main workflows, such as admission, discharge, or rounding, and then like charting before patients visiting, combined with AI scribe, and the proving ROI on it. For instance, let's say we are solving like discharge. So there will be like, there was some patient-doctor conversation elements coming in that pull from the EHL, like talking, and then our solutions talk to hospital guideline, and then like universal United States guidelines, making good recommendations, and doctors coming in, and then kind of make discussion with doctors. Hey, this is an idea. What do you think? This and AI, and then I'm trying to make this as like meaningful doctor AI relationship, as I said, with the right UX rather than just asking per thousand clicks. This is an idea. This is why. So that users will be able to acknowledge and agree with this theory, so that they will make better outcome working together, faster and better quality, and hospital make more money. I'd like to say our kind of like long-term goal is how we can make patients get better, doctors go home early, hospitals spend more money, and we want to put 3 points more boost.
Amazing. That's kind of a new iron triangle for healthcare products, right? Like for healthcare outcomes. I guess I love it. As you're thinking about this glow up, what's your approach to partnerships and your overall go-to-market? Who are you here at Health looking to meet, and how are you growing?
One way to grow, now we're actively raising Series A. One of the things we are hearing is that we found product market fit. People love our solutions, but we also need to prove that we want to get loved by end users. Clinicians don't love it, we are not going anywhere. But hospitals should pay more money because if we have an ROI. So we are trying to improve our ROI, and then we are actively working with our partners. When we say partner, we say content and IP.
AI needs
Like,
data.
AI and IP does more well in general. You know that OpenAI releasing new video generation, like people are getting crazy, like Studio Ghibli anime style, whatever. But in medicine, things are a little different. We talked about discharge a little bit. Like hospital system, like doctors trying to make a safer decision for discharge so that they can discharge faster and safer. It's not really about asking AI, hey, can you discharge a patient today? There are a series of like evidence-based guideline pieces, validated and proprietary. And then AI cannot own it. And they can realize it if it's given. So that what we are doing is that, and then this proprietary IP has a lot of like ROI, proven ROI. So that, but what we notice is that they have consistent fear with AI. They are gonna be less and less like being, because people cares less about like opening PDF guidelines. There are doctors, list of doctors building PDF guidelines to 100 pages, and people are less tolerant on those kind of things. But AI is really good at consuming those to make a better outcome. And then we made really good fit with the partners because they're not tech company at all. And we have a platform of like building user-friendly, clinician-friendly interface, like end-to-end workflow tool for better discharge admission, whatever. Our turnaround time can be 10 days, 15 days. Meanwhile, like big companies taking half a year, 1 year. So that's where we are moving to. For instance, we partner with a company called MSG, which is the building guidelines for admission and discharge. And we are the only partner for them to build the discharge like assistance, helping doctors solve everything about discharge, making right documentation, better planning, incorporating solution inputs, AI scribe if necessary, incorporate. If they don't to the patient, that's fine. We handle that. Those kind of things, so that we make more money, they make more money, and then we take some of the benefits. And then because also EHI companies don't do this content play out.
Yeah. I love this. This is like a very good example of one of my favorite applications of AI, where you use AI to take care of the technical things and the checklist kind of things, right? What is the right process? What are the indicators? The AI is focused on a very targeted part of the process. So you let the computers do the computer parts and you let the humans do the processing and the thinking and the content. It's just a perfect alignment of like asking the tools to do the right thing. And then for training and for like the humans in that interaction can change, but because the platform has the right context and instructions, it can keep the standards in a way that's like hard to enforce otherwise. So PJ, I'm so enjoying this conversation, but we have one last question. The theme of the health show this year is heroes and legends. And I know that every entrepreneur has at least one mentor or somebody who has guided and encouraged them along the way that's really made a difference in how they got to where they are today. So I'm curious, how has a mentor or a leader impacted and encouraged you to be where you are?
I have so many mentors, but like I probably don't want to hear that. Oh, I thank you, my parents, and things like that.
Yeah, not quite time for an Oscar speech.
It's interesting. Somebody asked similar questions that I have no idea what to say, because maybe this is sort of special in medicine, because if you ask me who's the legend in physics, okay, Albert Einstein, like who's the legend in cooking, like, okay, Gordon Ramsay or kind of things, but who's the legend of a doctor? Like, I'm in medicine, I'm a doctor, I have no idea who the person is. Maybe we have some kind of culture, like suppressing like individual cult kind of thing, like Elon Musk and or Sam Altman kind of things. I mean, don't mean that there are no heroes. I mean, a lot of heroes are working in a team. Secondarily, if you focus on not just being a doctor or anything like the clinical, there are usually innovations coming from industry first, non-medical, large language model, everything. And then it takes so many years collecting all the dots and complexity. Big tech is not really able to solve. And then even healthcare company cannot really solve. It's a lot of struggle, trial, fail. People try, Google Glass, not working, is dead. Those management situations are happening. So then, well, usually for me, the legend, and now nobody will talks about Apple nowadays because of AI everything. But when I first started it, my legend was, I feel a bit shy to say this, but it was Steve Jobs.
Awesome. I love it.
Not many people talk about him any longer. More people might talk about Sam Altman nowadays, because the reason is that that's when I was working in the ICU, watching his keynote, and then what I really enjoyed is that his like deep, hyper-focused obsession for end product desirability.
Yes,
Like
PJ, I love it so much, but we have to wrap it for our time. That's such a fantastic place to end. I love the accidental entrepreneur and wrapping with Steve Jobs.
Thank you.
PJ from Avo MD, thank you so much for joining me on the Health Tech Blow.
Thank you.
Amazing. Thank you.